My name is Gay Valimont. I am running in Florida's first congressional district, and healthcare is paramount for me. I am so I work in sports medicine. So if you watch sporting events and you see that person that runs out on the football field or basketball court when somebody gets hurt, that's me. I tape the ankles, do the rehab, um, a lot of times tell athletes to just get up and stop being babies. That's what I do for a living. um, but through that, I began to figure out that there were problems in our healthcare system because the majority of my athletes in Atlanta, I worked in predominantly Black high schools in downtown Atlanta, and all of my athletes were on Medicaid and trying to push through um, orthopedic issues through Medicaid that aren't considered a death sentence is difficult. That's been my first experience with healthcare and insurance. And then as I got into Florida politics, I became the leader of Moms Demand Action for Gun Sense in America. I grew our state chapter from 12 local groups throughout Florida to 32 groups, and a constant presence in the state house fighting bad gun bills, everything from stand your ground to permitless carry. And as things happen, I was kicked in the teeth, and my 44-year-old husband was diagnosed with ALS, and my 8-year-old son was diagnosed with a DIPG brain tumor 6 months later. I was their full-time caregiver until each of them took their last breath. My husband's been gone. My son's been gone 3 years, and my husband will have been gone 3 years in April. That experience, um, other than the emotional and trauma that I've been through and the pain, it also taught me a lot about how to navigate healthcare and the deficiencies in healthcare because my husband worked at a great company. We had great health care. Um, but after they were both terminally ill and had to seek treatments that were not necessarily approved by the FDA that we paid out of pocket for, we had to travel across country to take part in trials just to extend my husband's life one more day. Uh, Healthcare comes into focus for you. After all was said and done, I was left with $100,000 in healthcare debt after my family was gone. And I think a lot of people don't think about that. My take on healthcare is that it should be easy. It should be there for you when you need it. It shouldn't break the bank, and you should never go into debt because of it. But I also believe that every healthcare provider, every insurance provider should pay on the same pay scale. Medicare has been the pay scale that is and if I have any physicians on tonight, then you know that's the standard. The Medicare pay scale is the standard by which other companies can approve or not approve or make more money off of. But when I talk to people, when I talk to Republicans, when I talk to people about, hey, wouldn't it make more sense for the consumer if we all paid on the same scale? None of us were surprised when we walk out of the emergency room, or we're not surprised after a tragedy has happened and you've accumulated this certain debt that that the healthcare providers will give you a long list of things that you've paid for. And what I'm saying is we shouldn't have to worry when our loved ones are sick about paying $400 for 2 Tylenol in the emergency room as opposed to the $60 that Medicare would pay for. Um, I have spent my life fighting and taking care of people. Healthcare is just one of my initiatives, but it's a huge, major issue in everyone's life. It is the bill that you pay for your family that is either the second or third highest bill every month. And we continue to pay it, we continue to pay it, and then when it's there, when you need it, it's not there. So if you want a candidate, if you want to get behind a candidate that's going to go to Washington and fight for consumers, fight for good health care that's affordable, I'm your gal. Everybody has told us over and over again, this is Josh and I both, this is not going to be an easy race. Well, shit, we knew that. And we're in it to win it. I am going to continue to fight whether I win this seat or not. But I hope that on April the 2nd, I am the representative of Florida's 1st Congressional District.